think it's wonderful to understand all the things in your toolbox that you can treat your patients, whether it's an appliance, whether it's releasing with tethered tissue, whether it's Soleil asleep and you're just trying to tone and tighten that collagen. It's nice to have a full box of tools because everybody's different. Everybody wants a different outcome. They maybe have different expectations. And so some don't want to go the surgical approach of going to see the myologist and treating with the release. So maybe just Soleil asleep might give them some relief or an oral appliance. But when I talk to patients, my big thing is when they have sleep apnea and they've been diagnosed and they're wearing the CPAP, and I ask them, I say, well, why do you have sleep apnea? And they say, well, I did a sleep study. I go, I know that's pretty obvious, but the physician gave you a CPAP. Did they talk to you about why you have sleep apnea? Well, no, they said I took the test and I failed. And I said, okay. So no one looked at you and said, this is why you have sleep apnea. And so I always dive into it and say, well, diet and exercise first. You look like a healthy individual. Your medical history is unremarkable. You have some hypertension, but you're in shape, maybe a little bit, a couple pounds overweight, according to BMI. Everybody's overweight. But generally you're healthy. And skeletally, you're not so class 2 that your jaw's in the back of your airway. So why do you have sleep apnea? And that's when I dive into tongue and posture and how we breathe. And then I take intraorals and I show them the tethered tissue. And I say, and I have a diagram and I show them how their tongue will obstruct that airway if they're mouth breathing, how if it's on the floor of the mouth, the posterior part of the tongue will block the airway, especially if they're laying on their back. And I said, all we need to do is get a myologist, retrain that tongue to posture forward. I'll do a healthy functional release and you'll see them after, and your tongue will posture forward out of the airway. You'll breathe through your nose and you'll feel like $1,000,000. And patients are always like, man, no one explained it in that detail. I go in greater detail, of course, but no one has ever taken time to explain the anatomy to me and why I have sleep apnea.
Mhm.
So I think really that, the point of that, of what I like to explain to my patient is education. Like Erin, I'm a huge educator. I love to educate patients. I had a new patient in this week and she came in and saw my Google reviews. She had a couple broken teeth and I didn't really even address the broken teeth. I said, what's your complaint? She goes, I don't sleep well. So we spent 45 minutes about tethered tissue. She has a CPAP. We talked about that, sleep apnea, the cause of that, how I can change her life. I said, we'll have you come back and I'm going to put like a big resin on those 2 broken teeth, but we're not going to worry about crowns or bridges. Let's focus on your health. Let's focus on your sleep. And she was in tears. She's like, I love your approach. I'm all in. Where do I go?
Mm.
So, patients need sleep. That's the biggest epidemic we're having right now in this country,
Mhm.
probably elsewhere, is that people aren't sleeping
Mhm.
and no one's giving them answers.
Mm.
Taking a sleep test and giving them a CPAP or just an oral appliance, we got to look beyond that. We got to
Mhm.
dive in and say, what's going on with this person?
Mhm. You mentioned that she read your Google reviews and, on your site, you're promoted heavily as, a laser dentist, right?
Yeah.
Uh,
Yeah.
so how do patients reach out to you specifically because of laser? Or how has that benefited the business of your
Sure.
practice?
Sure. And laser is one of those things when my wife and I came up with Omaha Laser Dentistry is like, that's kind of intimidating to some people because they think laser like, oh my gosh, it's out of control and it's all over the place. Um, but really, especially nowadays, people are wanting a better way to do dentistry. They want something better than the drill. And
Uh-huh.
so we get a lot of patients who, pull up laser dentistry and boom, there it is. They want something that is not as traumatic. They don't want to be numb, right? So they're looking ways for an improvement in the technology that was so barbaric that terrified them as children. And they want a better approach that will be less traumatic, better results, not just for them, but for their children. Um, so laser dentistry is definitely one of those things that, is promoting and a better way to appeal to people who are terrified of the dentist. Because, I mean, we're not looked on as saviors, right? We're looked on as like, wow, you're a dentist. I don't like being here, right?
Sure.
And if you can do dentistry in a different limelight where there's less trauma, whether it's surgery or whether it's just restorative dentistry with no anesthesia, it's a game changer. And that's what it's been for my practice. It's just blew up in Omaha, Nebraska, that we get patients from all over the place who drive 2 hours for restorative dentistry or for treatment of tethered tissue from babies to adults. So it's definitely something that's enticing to people nowadays because they want change. They want something better.
Absolutely. It is a practice promoter for sure. And like I said, the Swiss Army knife for a lot of the things I'm already doing. I wanted to mention too, when you were talking about the maxillary release, it's everyone, you need to see, you need to see how he does it. It is not just cutting the frenum. I mean, it is releasing the muscle. I have pictures, but that doesn't help you on a podcast. So I don't know where to send them to look because if you talk about maxillary release, they're just going to show you a frenulum or, just cutting the frenectomy.
Yeah.
Also saying that, I struggled. I knew I wanted to be all in on this. My hygienist is a myofunctional therapist. I mean, we have a pediatric program. We're all set up in my practice, but I didn't know where to go learn.
Sleep matters.